welcome to the 988 Crisis Jam, Mile 1. We're so excited to have you here. My name is Dr. Aisha Delaney-Brumsey. I am the Director of the Behavioral Health Division at the Council State Government's Justice Center. Today, our featured presentation is going to be talking with Rachel Rios-Richardson and Justin Chase, both from Arizona. They will be talking about the move that Arizona is making to a statewide 988 crisis line, and also walking us through some really interesting feedback that they've received through a survey of people who've used crisis lines in 988 in Arizona. So definitely going to be a really great presentation. I'm very excited about that. So this is so deeply exciting to see, but we are all nearly 3,000 strong in this community. This Crisis Jam has representatives from all 50 states and internationally, and that number is just both a reflection of the quality of the work that you all bring into this space, but also the attention that's this very important issue has been getting nationally. So I'm really excited to see the growth over the years worth of time in this session. So we have heard that people have had some challenges with the invite disappearing from their calendar. So if you're having the same frustrations that Captain Picard is having right here, you can download, and there will be a chat in the link in the chat for downloading the calendar invite, and also on the newsletter there is a link for you to download it. And if you have any challenges with both of those, then you can reach out to Karen Jones and she can help you get it onto your calendar. As always, if you go to talk.crisisnow.com, you will be able to get onto this learning jam, but also get all of the information, including importantly, swag. So there is now an ability to get virtual backgrounds and t-shirts for this 988 Crisis Jam learning community. And if you haven't, you'll see a picture of the t-shirts soon, and I highly recommend them. They're very cute. And as always on this page, there are also highlights of the previous featured presentations and other information from the learning jam. So if you missed something, you want to share it with one of your colleagues, it's always there for you to access. All right, just a couple of news items that you'll also be able to get on the website, but also in the chat. We're going to be talking about this issue in a future Crisis Jam, but as we know that as U.S. mental health hotline networks are expanding, rural areas are still facing challenges. And so this really talks about some of those challenges, but also the importance of figuring out how to bridge that divide. And we do know that there's really good work happening in many rural communities to build out comprehensive crisis systems. And this article touches on that as well. Recently, SAMHSA and the VA held an innovations conference, and you can see Dr. Richard McKeon, who's a frequent supporter here and frequent participant, along with Representative Tina Orwell from Washington State, were able to meet there, and the representative was really championed some of the early legislation around ensuring that 988 was sufficiently funded in her state. And then next, we will be having, there is an article that you will be able to have access to, but in a future Crisis Jam, there is going to be a focus on a really important topic, which is embedding equity into 988. So this article was done by the Kennedy Satcher Center for Mental Health Equity, along with several partners, and looks at the strategies for ensuring that 988 is able to meet the needs of communities that are often and sometimes overlooked by our crisis systems, BIPOC communities, people with disabilities, people in rural areas, and it has a series of recommendations on how to embed that equity into 988. So definitely tune in for that and take a look at that article as well. You know, it's a very important topic that many of us in this room are working on. And I believe this was brought to us by Dr. Malji Balfour, just a notice that CARF is in the process of revising their crisis standards, and they are soliciting feedback. I believe you have, yes, right here until August 22nd to solicit, to provide your feedback. So please do. And there will be, I believe, a link in the chat, but I can see them also on this slide here as well. So very important to make sure that they get all the good feedback about how they should be adjusting those standards. Finally, this quote from Representative Tony Cardenas, law enforcement officers agree they're often not the best equipped to respond to a mental health emergency. In most cases, a call to 988 doesn't involve law enforcement. If available, a mobile crisis team may be dispatched to help. Now that 988 is live, we need to make sure that states have the funding to respond without unnecessary police involvement. That's a quote that's near and dear to my heart. That's a concept that's near and dear to my heart. At the Justice Center, we've been doing a lot of work to ensure, and many of you on the phone in this virtual room as well are doing that work to ensure that the appropriate response gets to the appropriate person, and that we're not over-relying on law enforcement and emergency rooms when we should be really moving forward with a health-first approach and reserving those public safety resources for more public safety-focused concerns and calls. So this is a great quote from the representative. And now I'm so deeply excited to bring up our our featured presenters. I'm going to start first with Rachel Rios-Richardson from the Arizona 988 Advisory Committee. She's going to be speaking about the highlights from the Arizona Crisis Line survey that they recently fielded. Rachel, can I turn to you?
Yes, thanks so much. I'm really happy to be here. I'm just going to share a little bit about a survey that we worked on in collaboration with Access, which is Arizona's Medicaid agency. At the time, I was with LeCroy Milligan Associates, which is a research and evaluation company. And an exciting thing that we got to do as part of the 988 planning is that we really wanted to reach a wide range of people with lived experience of contacting crisis lines in Arizona. As you may know, Arizona has a really robust crisis system, but it has a lot of pieces. And so there hadn't necessarily been an opportunity to survey people about their experiences, regardless of which line they called, whether it was a local line or the National Suicide Prevention Lifeline, at the time, the 1-800 number, or local crisis lines. We can go to the next slide here. And so we sent out a survey really broadly to stakeholders who might be interested. And we were especially trying to reach people who had called for themselves or called for someone else. And it was really an honor to get this feedback and learn from everyone who responded to the survey. I myself am a person with lived experience and have had experience calling crisis lines. But of course, I'm just one person, and it was great that we got to hear from hundreds of folks who had that experience. So we got responses from 180 people who had called for themselves, and 391 of our respondents had called for someone else. And there was a big overlap. A lot of people had done both calling for themselves and for someone else. And this wasn't, a representative sample. This is just whoever responded to the survey. So just kind of keeping that in mind. And the survey happened about a year ago. So it was prior to 988 launch, of course, and really helped to inform the planning in Arizona and the implementation plan for 988. We can go to the next slide here. So something that was really striking from these survey results of people calling a variety of crisis lines is people were really split in terms of whether their experience was positive or negative overall. And so about half and half for both people calling for themselves and calling for another had a somewhat or very positive experience. And then the other half had a somewhat or very negative experience. And so we learned a lot that people's experience really varied, even from their comments. As we analyzed that qualitative data, we found that sometimes one person would have an excellent experience one time and a really challenging experience another. And so we really got a sense of the range of experience that people had. And there were a lot of positive comments, of course, of people talking about it being a life-saving service and the support that they received. And then other people talked about barriers they experienced. We can go to the next slide. So overall, from the survey, as well as our stakeholder meetings throughout the 988 planning process, we learned a lot from folks with lived experience. And here are some common experiences with crisis lines that people shared about from the survey. They felt that people had positive experiences, felt like their call was answered quickly. They felt understood during the call. They felt calmer by the end of the call than at the start. And a positive experience for people who called for someone else. One common experience was that the crisis worker offered to send someone in person, a mobile crisis team. And then some of the top challenges is people who felt like their needs were not met and that they waited on hold for what felt like a long time. And so this kind of alerted us to an issue where sometimes people's original call might be answered quickly and then they might be put on hold. And so in the planning in Arizona, this is something that stakeholders are trying to address and make sure that people are not on hold for long. There were also some challenges for some people about their calls getting transferred. And for people who called for someone else, they felt like sometimes they asked for someone to come help in person and they felt like they had to wait a long time. We can go to the next slide. And so overall, some major themes that came up from the survey as well as our meetings is that there was and continues to be a really strong community interest in having the 3-digit number of 988. Like I said, experiences really vary with calling crisis lines. So that's something we're working to make sure that people have a really consistent experience. And needs for more crisis services in rural areas were really highlighted, as well as for some specific population groups like children and youth. And then we're fortunate in Arizona to have a strong system of mobile crisis teams, but nevertheless, for people who had wait times for mobile crisis teams, they really expressed how big of an impact that they can have on their experience in a moment of crisis. And we did learn that many community members would like to be able to both have the option to call as well as text a crisis line. So I'm going to be turning it over to Justin next. And thanks again for glad to be here.
Excellent. Thank you. As many of you have heard and maybe tired of hearing, Arizona's had a robust crisis system for decades, which has included a number of regionally based crisis hotlines. So the National Suicide Prevention Lifeline came online in 2005. It was set up as a parallel system and not integrated into the existing structure, as you can see here. Today, MPAC La Frontera, which is one of the original NSPL centers, along with Solari, serve as the Lifeline centers serving Arizona. A few years back, Arizona State Medicaid Agency, AHCCCS, made the decision to streamline the state-funded crisis hotline into a single statewide crisis line vendor, which will go into effect coming in October. The 3 managed care health plans responsible for management of the crisis system in Arizona selected Solari to serve in this capacity. So with the implementation of 988, the state took the opportunity to align the Lifeline services more closely with the state-funded crisis line. So if you go to the next slide, you'll see effective October 1st, all state-funded crisis line calls will flow into Solari's crisis operation, as well as the 988 calls for the state of Arizona, where jointly Solari and MPAC have partnered to ensure a vast majority of the 988 calls are answered within the state. So next slide. So why keep 988 and the state-funded crisis lines separate? It's a common question we get. So you'll see in this chart the volume discrepancies between the state-funded line represented in red compared to the Lifeline represented in blue. Though we anticipate some shifts in traditional state-funded callers to begin dialing 988, we don't anticipate the shift to be too drastic. Therefore, it makes sense in our state to keep these numbers separate, but the services offered seamlessly integrated. So next slide. This slide demonstrates some of the current performance of Solari's operations on the state-funded crisis line for central and northern Arizona. You'll see in the top right corner the steady decline in call volume as we enter the summer, which is consistent with schools going on summer break and matches our historical volume. What you'll also see is that July did not see a significant dip, as some may anticipate with 988 rolling out on July 16th. I know there's a lot of data on this slide, and I'm happy to dive into more details if anyone is interested in another time. So what does a comprehensive 988 response look like? This slide demonstrates how Arizona fulfills the complex needs of individuals and families experiencing a crisis situation. Arizona has adopted a no wrong door philosophy to access crisis services, where an individual in crisis anywhere in the state has access to a crisis hotline, community-based mobile response teams, and crisis facilities, as well as individualized post-crisis follow-up care. The overarching goal of this comprehensive structure is to provide the most appropriate care in the least restrictive environment in order to decrease unnecessary inpatient hospitalizations, emergency department utilizations, involuntary or coercive treatment, and incarcerations. So now the statistics are impressive and demonstrate the capacity in place to field these calls, but what's kept me up at night is wondering if the quality of the call continue with this massive increase in volume and demand with 988 rollout. So the answer is yes to that question. The quality is still just as strong post July 16th as it was before. And what we're hearing from folks and callers during 988's first week is people saying that they woke up feeling hope, now able to listen and speak positive messages to myself. Never called the crisis line before, but I'm very glad that I did. The specialist helped me reflect and think through my experience. And knowing you were going to call me back helped me stay alive. So thank you.
Thank you so much, Justin. And thank you so much, Rachel, for both of those presentations. They were really fantastic. I'm going to bring up onto our virtual stage two people to discuss what we just heard. And should there be time, I'll also try to take some questions for the audience. But we have CJ Lucelle and Heath Hay coming in to discuss what we just heard. Welcome.
Good afternoon, everyone. Thank you.
And CJ, should I turn to you first?
Sure. So I'm CJ Lucelle. I'm the crisis administrator here with Access. So got to work really closely with Justin and Rachel during the implementation planning process. Towards the end, though, one of the things that we learned from that survey was that we really needed Access as our Medicaid agency and our state mental health authority to focus a lot more on crisis to really support this national movement. One of the things that came of that was the creation of a crisis unit within the Medicaid agency, rather than just having certain parts and units pay attention to different parts of the crisis system. So that's been really great learning experience. That survey really helped also inform us not just what we could do to support 988, but that response system and addressing the needs of our actual residents in Arizona and how they're experiencing that response system after they call. So getting a person to call is always going to be a challenge, overcoming the stigma of accepting that you need help and reaching out for that help and knowing where to call, right? Those are the big challenges in reaching the general population. But once someone calls, we really want to focus on, although we have a robust system, making sure that the quality of that system and the way that it's perceived really represents a positive outcome at the end of that crisis interaction.
Thank you, CJ. I think that's a great point also just about the steps that people need to accept that they need help and be able to make that call. And great to hear how how you took some of that information and really are thinking about how it reflects the needs of people who are coming into contact with your system. Thank you so much. Can I turn it to you, Heath Hay?
Thank you, I appreciate it. So I'm Heath Hayes. I represent the Department of Mental Health and Substance Abuse Services here in Oklahoma, and we just want to be like Arizona at the end of the day. That's why we partner strategically with Solari, and thankfully they have accepted our partnership and have been operating our 988 call center for about a month. And so kind of just to echo some of the same thoughts behind what it is that we want 988 to be. It really is a communication, from a communications perspective, is to allow people to know that 988 is there to help anybody, whether you don't have to wait till crisis situation in order to do that. And so all of our communication around it is going to be more anti-stigma focused, and with the input from folks who've lived experiences and using their experiences as part of the drive to get people to be aware of what 988 has to offer. Launching within the last month and building the system, the response system with the mobile crisis teams, changing some laws allowing transportation of folks who need higher levels of care, not to have to be law enforcement, to kind of specifically work with law enforcement to help them not necessarily be involved with the process and unless they're needed, has been an ongoing effort for the past couple of years. And so we are excited to layer in 988 to use this opportunity to build the system that we know that will help people, because we know that when somebody touches our services within Oklahoma, they are twice as likely to survive any type of mental health crisis that they might experience. So as more people that we can get aware of and to connect with us through 988, the better for Oklahomans. So we're on our way, and thank you so much for allowing us the opportunity to share some information about our thoughts behind it today.
Absolutely. And before you go, there's one question from the audience, asking about whether or not there's a way for people who are deaf to use the 988 number in Oklahoma or another number that has a video phone. Do you happen to know that?
I don't know. Justin, do you know?
We're exploring the opportunities for improvement there, but right now they're relying heavily on like a 711 operation to really fulfill that in the current operation. But I think definitely needs and continues to be a dialogue around how we can better provide video phone accessibility for individuals, definitely hard of hearing needs. That's
fantastic. And there's actually another question that just popped up also in the chat, if I can raise that. Regarding phone transfers, when are transfers more likely to happen when someone calls 988? Is it when a call, a receiving organization is unable to respond in a timely manner, that they transfer to a less busy call center? And any information on how long wait times are before they need to be transferred?
Yeah, this is probably a good one for me to grab. Is so the transfer process from the survey really is more moving between staff, and there's a number of different hotlines that operate within the state, so it depends on which line they contacted and where the experience would be. What we're finding with 988 is we're grabbing, depending on the state, between Oklahoma and Arizona, currently 95 and 99% are being answered and fielded within the same agency from the initial grade. What we're finding is average wait time is less than 29 seconds for individuals for once the initial triage and safe to hold protocol is addressed, which again is not terribly common, but we do put folks into a hold queue in the event of high volume. We do ensure that we're holding the individuals are not falling through the cracks through a heavy transfer or long period of wait. So the hold times can be a little deceiving. There are times that we have folks that may request a specific agent to speak with, or a unique circumstance where they're looking for the event they want to specifically talk to a female staff member, or somebody with lived experience that we may not have, that may be on a different call at that moment. We may have a hold period for that process. So
that's fantastic. Thank you so much. And also, just for folks, I'm sure you guys are all paying attention to the chat, but I just saw that Megan helped also put NASHBID's recent recommendations on 998 and deaf crisis services in the chat, which is a fantastic publication. Justin, one question for you. You said something that caught my ear when you were talking. You were saying the numbers will remain separate, but for the user, the services will be seamless on the back end. Can you just say a little bit more about that and what that looks like practically?
Yeah, so the streamlining process, from the partnership we have with Access in is specific to Arizona, is the calls route into the same phone system. And traditionally what had happened is if you called through the National Suicide Prevention Lifeline, say that somebody needs a mobile crisis team, that would then have to move over to the state-funded operated crisis system to then coordinate and dispatch that mobile team. And sometimes that delays the process first. People may wind up having to tell their story again. It just gets a little clunky in that process. So what we've done in partnership with the state and the other crisis providers and partnering with Impact has been a great partnership for us, is ensuring that seamless system, we're entering into the same database, we're entering into the same system. So the data is all flowing, the calls are all flowing. So once they're grabbed, they're being held onto during that process. So it really allows that seamless coordination to ensure that the robust crisis system that Arizona offers, once you hit either the 988 system or the state direct 10-digit number, you're able to hold on to that process.
That's fantastic. Thank you so much. I also just want to elevate one thing you said, that, it was really keeping you up at night around whether or not the quality would remain the same. I was really heartened to hear that you're seeing that it really remains the same. And that one quote, that sounds like one of you got from one of the people who'd called the line, that they woke up and they felt hope, is the kind of thing that I think certainly keeps me in the work. I imagine keeps you and other folks in the line on the work. Is there anything else you'd like to say about how you're seeing some of that quality remain the same, and what's really heartening for you, even as this shift is going on?
Yeah, we're breaking down barriers and tackling stigma and parity, and so many opportunities there. So I think the window is wide open for this continued conversation here in the jams. This is just the beginning. And so we're really forging a pathway forward. It was scary going into July 16th, what it would look like, the anticipation, and I'm so glad that we're post July 16th, that now we're in it. Let's work through it. Let's work through the challenges and opportunities. It's not perfect, but we're here and we're forging ahead. I'm thrilled for that. The staff have been incredible on the front line that are fielding these calls. The volunteers for volunteer-based centers are just incredible. The workforce shortages, there's a lot of work going on, a lot of hours going into this work, but the experience for each individual caller is critical, and that's where our focus needs to maintain. And I'm just thrilled to be where we are today.
That's fantastic. And, we know this is people. I know this is a clinician, and this is a system change person. Change is scary, but I love the theme that you're raising, because that's a theme of this crisis jam, is that we're getting started. We're continuing the good work of building crisis systems. This is, I think, now that we're calling this mile one, really reflects that idea that we're at near the beginning, and we have a long but I think fruitful journey forward. So thank you so much, Justin, and thank you so very much, Rachel, as well, and also to both of our discussants. That was a really fantastic discussion, and I'm glad to see all of this work. I do see folks are still putting questions in the chat. So Justin, Rachel, CJ, Heath, if please feel free to respond in the chat as well. Thank you all. And just a reminder to everyone, the slides and the recording will be on the website. So if you missed anything, then you will have an opportunity to see it. Okay. All right. We get to what is 100% one of my favorite parts of this weekly meeting, which is the trivia hot seat. If you ever have the kind of scary privilege of being in the hot seat, you do get to have your own t-shirt, which I didn't lie, guys, these are really cute. You can see all of the different quotes that you can have and the logo. So that is a real incentive for being in the hot seat. So now that means I'm going to bring up our hot seat contestant. So can I call forward Laura Stein, who's the Executive Vice President and Chief Policy Officer for the American Foundation of Suicide Prevention.
That's right.
Yes. Thanks, Laura. So yeah. Laura, welcome.
Thank you. Good afternoon, everyone. Hi, Aisha. So yeah, I'm in the hot seat. Whoa, this is a hot seat. So how should I proceed? Should I just read this question and select a? Okay.
Yeah, I'll read it for the audience so we're all on the same page, but take a deep breath, get ready, you got this. I have all the faith in you, and we're all here for you. So the SAMHSA National Guidelines for Behavioral Health Crisis Care lay out 3 core elements as well as essential principles and practices for a modern crisis care system. Which of the following was not an essential element as defined by SAMHSA's national guidelines? Everyone should see the options up on your screen. Please select what you think is the option. So option A, significant role of peers. B, safety security for staff and people in crisis. C, partnerships with police, PSAPs, and EMS. Or D, co-responder crisis outreach services. So once we get enough people responding, the wisdom of the crowd will just pop up on the screen. So Laura, you're going to see that, and you're welcome to go with your own wisdom, with the wisdom of the crowd, or you can even phone a friend. If you see a friend that's in the room with us today, you can ask their advice too. So here we go. So the crowd is, it looks like overwhelmingly D is the crowd's answer. So where are you falling?
This one's a tricky one, right? Which is not an essential element as defined by SAMHSA's national guidelines. And all 4 of them to me are pretty essential. So let's see which is the least essential. Okay. Well, the crowd looks like they're going for a co-responder as the answer. I wonder if well, definitely not A. Safety, security of staff and people in crisis. Responder, crisis outreach service. Yeah, crisis. You know what? I'm gonna go with the crowd. Instead of phoning one of my friends, I was looking maybe Debbie Plotnick from Mental Health America. But let's do D.
All right, let's see the answer.
With the consensus.
Let's see it. All right. That is correct. D is correct. And you can see here a quote from Ron Bruno, who is the Executive Vice President of CIT International. And he says that we have to challenge the belief that mental health crisis services must come in a police car, and suggest primary and embedded law enforcement models are the least economical solutions. So I think the idea here is that for certain calls, for certain types of responses, you may need a co-response team, but for the vast majority of mental health crisis calls, you can really be sending those health first responses. I think it's really powerful to hear someone like Ron Bruno, who's spent a lot of his career supporting CIT and other law enforcement models to really acknowledge that. So Laura, you did great. I mean, you get a t-shirt no matter what, but you get bragging rights.
But honestly, because so many people on this call went for D, it just is a testament of just the level of awareness and education that everyone has and on 988 and the crisis services and the work of SAMHSA and everything. So thank you for leading me in the right way. It's always good to go with the majority when you know you're in good company. So thank you for the opportunity, Aisha, and David and Karen and everyone else from the Crisis Jam. Nice to be a part of this.
Thank you so much, Laurel. I mean, yes, you're right. If it's a smart crowd, you got to go with the crowd. And this is a smart crowd.
Thank you.
Okay. Really excited now to bring up Stephanie Hepburn, Crisis Talk Editor-in-Chief, and Dr. Chuck Browning to talk about the most recent Crisis Talk article. Stephanie and Chuck, I will pass it to you.
Thank you, Aisha. So yeah, I'd like to welcome Dr. Charles Browning. He's my colleague and Chief Medical Officer at RI International. He and Lisa St. George developed a tool. It's called the PeerPowered Scale Organizational Self-Assessment. Chuck, if you're on the call, if you could talk about why you developed it and what it highlighted once you actually implemented it.
Thanks for this. We did this article several months ago, and then having it come out, it's nice to be able to share and talk about it. So, we originally started just as an internal tool so that we could use a way to measure how well are we accomplishing peer-powered concepts at each of our sites in different states, and then use it as a quality improvement tool. And our original design was to take, I really like the framework of Zero Suicides toolkit, and how we use that at our facilities to work on improving overall concepts and guidelines for suicide prevention within our organization. And so we started several years ago working on developing this internal tool and have piloted it at our different sites and gotten scores. And it's got some similar elements to that Zero Suicide Toolkit, where we're measuring voice, culture, and leadership of peer support and being peer powered, and actual peer powered practices that we describe, and then systems and tools that your organization would use to accomplish that. And then the goal, like a lot of—
Can you define what does peer powered mean? Can you explain that?
Yeah, so we define peer powered as kind of a twofold thing. One being just the overall inclusion of peer support and peer voice in both the work that you do, as well as throughout your whole programming and organization, whether it's leadership or whether it's in design and co-design of things that you do and the people that you serve. Are you building that in? So that's one element. And then the second big element that we use to measure this is what we call peer-powered practices. And so that's the concept that recovery-oriented things, trauma-informed practices, working with people instead of doing things to them, which is really easy to happen in crisis care. Some of those concepts, we call them peer-powered practices. And we expect all of our staff to know how to do that in the role of what they do, whether you're a provider or a nurse or a licensed clinician. It's not just our peer support that are performing that. So part of the assessment tool is to use it as an organization to measure how well you're capturing those things. And then the last category is just tools. So training, systems, tools in your electronic health record to measure and be able to do continuous quality improvement on how well are you handling these things. So you could be an organization that has no peer support at all and would score all zeros right now, or you could be an organization that's really geared into using this tool and use it as a way to measure where you are and have discussions about where you can go, what are barriers to accomplishing that, those types of things.
And you said it takes roughly an hour, is that correct?
To actually answer the questions is like 5 minutes or less.
Okay.
I would recommend, though, that if an organization wants to use it, that you have a workforce that answers the questions and then uses those questions as a framework to discuss where you are with those different things and what you want to do about it in terms of action items. What things can you go ahead and start acting on now? And then maybe are there things that are harder to act on that you might need to assess barriers, work on change elements of what you would need to bring to the table to change.
My last question is, you were able to identify some inconsistencies very quickly. Can you talk about that?
Sure. I'll give you just 2 or 3 quick examples. One was just in peer leadership and voice. We've used the tools to help drive our overall inclusion of peer voice in our executive team, board of directors, and leadership within the actual middle management layer of our company too. So that's an example of something that came about as looking at that tool and measuring where are we with this and it making a change and improvement in that. And then in terms of peer power practices, several things that we've taken and looked at. So example, evaluating where are we with truly practicing concepts of trauma-informed care at every site, and then finding elements that might need tweaks and improvements. And then we adjusted, looking at the system in the back end is what trainings are you doing? What tools are you using to measure? Are those practices being incorporated, and are the people who are actually receiving those services experiencing that or not?
Well, thank you so much for hopping on the call, Chuck, and I'll pass it back to you, Aisha.
Thanks.
Thank you so much. That's fantastic. It's also really great to hear how other jurisdictions might follow your example and use some of these approaches to improve their own practices. So thank you for joining us. Next up, I would like to call forward Craig Miller to bring us a lived lens here. And what you're seeing in this image here is really showing what we touched on a little bit, that theme of where we are kind of at the starting point and how we want to make sure that we are articulating a vision for a comprehensive crisis system that is flexible and compassionate and really meets the needs of people that it's meant to serve, but includes within it the experience of people who've lived crisis systems in the operation and design of those systems, just as, which is also a great transition from the previous presentation. So Craig, I know that you're going to be here to give us some reflections from your own experience on this. So can I please turn to you?
Sure, absolutely. Thank you. I think For me, the biggest thing with this 988, just in general, to even back up a little bit, is the fact that they are listening, right? So being with lived experience and kind of taking the road that I've lived my life. When we're in crisis or when someone is in crisis, you look to them to help. This the elusive they, like, are they doing anything to help? And now they are implementing a 988, a system across the country, which in itself is a pretty good message that there's a huge recognition that we need to do more, and that people are listening across the country and in every state. And every time I get a chance to come to these meetings, I'm so inspired by the work that's taking place and the amount of knowledge that's being shared and the best practices that's going around. It's just absolutely awesome. Yeah, so that's my biggest thing on that is the fact that it exists right now. And my personal experience more than anything is, not to beat on the word experience, but it's true, when we do reach out for help, it's the experience that we pass on to other people in our group, among our peers who have issues and need help too. If we call, it was interesting to see the graph earlier where it was sort of 50-50 based on the survey, that if it's not a good experience, that message is going to get around. And if it is a good experience, that message is going to get around too. So the experience that people have, I think, is more important or just as important as helping them get through the immediate crisis or whatever they might be going through. So to me, this is wildly inspirational to see. And every time I have a chance to give a talk, I bring up things I learned from these meetings to the audience. So thank you.
Thank you, Craig, and thanks so much for that reflection, and also really highlighting the power of being able to understand that when, I think, if I'm hearing you correctly, and please do correct me if I'm wrong, when you come into a space where we're talking about making big shifts and policy changes, it's also helpful to be able to see that it means what that means for you as someone who might themselves use crisis services, that there is a set of systems that's working to provide care for all of us and for people themselves who have experienced crisis. I have one question, if you don't mind if I ask. You
Sure.
said that, when you give talks, you talk a little bit about what you've heard in these spaces. Is there anything, or in this particular space, is there anything that comes to mind for you when you think about this crisis jam that really stood out for you over the past weeks or months?
Yeah, but the one that stands out to me above all, and I apologize, I don't remember the gentleman's name who presented, but I know he was from Los Angeles and managed crisis centers there. And he said that when Los Angeles gets a call for someone in crisis, they will forward it to his center. And instead of sending police with guns, they send crisis counselors with guitars. And I don't know if I'm sure some of you were on that one a few weeks back or a month back or so, but man, that was so touching and so moving. I mean, I've never experienced something like that, but I can't imagine how effective that must absolutely be. I have had, when I was younger, I did have police show up in two different circumstances. One was a fairly aggressive, and they just they didn't know how to handle it and wanted to be done with it. Another experience with police was a female police officer who showed up. She parked her car kind of a little bit down the road, so you really didn't know what house she was going to. No lights, walked me out. I sat in the front seat with her. She basically all but held my hand the entire way to the hospital. And that, to me, that itself just, I can't explain to you when you feel like you're in crisis and that's it, and you need help and you actually find it, that stays with you, and the next time you go through something, the next time you experience something so heavy, and that there's help out there, and you've seen it. Especially for me, I've seen it in some cases where I didn't get the help I wanted. I was on that unsatisfied side of the slide, and I've had experiences where I've gotten help. So when I go into when I go into a crisis and I reach out for help and I'm not getting what I need, knowing that I once had a good experience, knowing that exists and it's there for me. It might not be this particular one or this person, but I know eventually I'll get there. That in itself helps me get through what I'm going through.
Yeah, no, thank you, Craig. I mean, that is a deeply powerful learning experience, and I hope it's one that we all get to have in our life, that when you reach out for help, you're met with help that is meaningful and that is compassionate and that recognizes you as a human and someone who's in a difficult point. And I can definitely sympathize, and I understand. I can feel the power of that, and so I really appreciate you, Craig, walking us through that. And thank you for joining us here. Appreciate your time.
Thanks for having me.
And now, as we're coming to the final quarter of today's meeting, I'd like to bring up Dr. Ted Lutterman and also Dr. Matthew Goldman to be doing our data corner. So Ted, I know that you're going to be talking to us about some work that NRI has been doing to understand where states are in terms of building out comprehensive crisis systems, and you're going to be talking us through some of that initial data. I'm really excited to hear that.
Thank you, and thank you to all the states and people that have been responding. We are wrapping up an inventory of where states are at in implementing the full Crisis Now continuum. So we worked with the work group of state mental health leaders, peer specialists, Nashville, got feedback from RI International and others. And the survey went out to states in May. And so today I'm presenting some early results from 34 states. If your state is on this map in white, we would still love to get your information to include. We want to have information from all 50 states. The overall questions that we asked focus on each of the core components of the Crisis Now model, looking at call centers, mobile crisis stabilization programs. And we're getting information about what models are used, their workforce, funding sources, the budgets, the number of calls or visits they're doing, staffing, implementation plans and issues, who's running them organizationally, as well as information on other crisis initiatives such as crisis residential, work on 911, 988 collaboration, transporting people in crisis to services, and focusing on what data outcomes are being measured by states and crisis programs. If we go to the first slide, or the next slide, today what we want to talk brief about is some of the workforce shortages, because we're hearing every state is experiencing workforce shortages. And we asked what shortage areas do they see at call centers, mobile crisis, crisis stabilization, which types of staff are the biggest shortage. And what's interesting was the call centers actually had the lowest number of states reporting shortages, probably because of all the attention for 988, and SAMHSA is supporting the national jobs line for call centers. What we see for call centers, that it was social workers and peer specialists and other licensed behavioral health counselors are the largest shortage areas. Interestingly, in follow-up questions, we see that 22 states have already developed or in the process of developing and providing specialized training to peers so they can work in the crisis system. So on top of their regular peer specialist certification training, doing additional training to work in crisis services. The next slide looks at the shortages for mobile crisis teams. Here we see many more states reporting shortages. It's the same sort of set of staff though. So again, it's social workers, licensed behavioral health counselors, and peer specialists are cited by states, but many more states. We're also seeing more shortages though for nurses and psychiatrists and medical staff to support the teams. And one thing we've been hearing from states was a number of states in trying to get staff for 24/7 mobile crisis, they just have not found they can get enough master's level clinicians. And so a number of states are actually changing their requirements and starting to move towards bachelor's level people for the mobile crisis teams because they just can't get enough master's level social workers or licensed practitioners. The final slide looks at for crisis stabilization programs. Having these set up and running 24/7 is, I think, becoming the largest challenge for states. And here we see that the medical side, nurses, psychiatrists are major shortage areas, along with, again, social workers, mental health, behavioral health counselors, and peer specialists, as well as just sort of mental health aides, technicians, other people to help keep the programs running. So we're gathering that. We also have information that we're getting to what states are doing to address these shortages. And I think we're seeing a lot of interesting initiatives that we want to share with states. Several states have gotten substantial amounts of American Rescue Plan Act money devoted for growing or maintaining their behavioral health workforce, sponsoring tuition, internships, working with universities and community colleges to set up training programs to grow the workforce. Also, some states are using state general revenue funds. So over the next few months, we want to get all states responding, and we'll put out a series of reports. We'll have information on our website that will be available to others. And we hope this just be a tool that states can use to help share their lessons learned with each other.
Ted, thank you so much for that presentation on Data Corner. Really appreciate your taking the time. There are a couple questions in the chat that I just want to flag for you if you might want to answer those there. A couple additional points just to share with the group. I'm sharing here 2 publications, which I'll put the links in the chat in a moment. The first is by a group from Australia, Hogwood et al. I know this is an international call. We've got folks from all over the world who are joining this call, including some partners in Arizona who's been really at the forefront of doing crisis work. And they did a study of their crisis counseling lines and had some very interesting findings around counselors' experiences of effectiveness of suicide prevention, of the potential utility of additional training on suicide risk assessment, and also the impact of vicarious trauma on call center staff. So really interesting findings there. I encourage you to check out that article. And the other is by Drs. Leah Pope, and Michael Compton. Dr. Compton is a real expert in CIT and has done studies in that area for years. And they wrote an open forum in psychiatric services around 988 and 911 coordination in particular, and some key issues in that area as well. And then the research funding, this is sort of a standing feature for those who are interested in research. There are notices of special interest from the National Institute of Mental Health to try to encourage submissions for grants in these priority funding areas. So if you have any questions about that, feel free to reach out to me and I can try to help point you in the right direction. And of course, there's also the NIH program officer contact information at those links. Thanks so much, everyone.
Thank you so much, Matt and Ted. And I see we're getting some really great questions, Ted, in particular about what kind of data you might be collecting in that survey around competency restoration for states, and a few other questions. Looking at the time, I think I'm going to move us instead of bring you back up to answer those. But if you do have a chance to respond in the chat, that would be fantastic. Matt, thank you so much. Now I'm going to bring up Dr. John Palmieri, you with us for the SAMHSA update.
Hi, Aisha. Thank you. And yeah, we're looking at the time. I'll try to be brief and just go through a kind of a list of things that we are currently focused in on, and then I'll pass it off to Dr. Richard McKeon for some additional updates. So first of all, just wanted to flag tremendous gratitude and appreciation for the Vibrant team in particular in supporting 988 transition and significant increases in volume for individuals seeking services and continuing to enhance capacity so that the system does have the capacity to respond to those individuals in crisis. So very appreciative of all their work. We will be coming out with some additional data, I think probably next week for July, and then we'll, moving forward, be kind of in a cadence of providing monthly data so that people have more kind of visibility into the network performance. We are working with our partners with the Assistant Secretary of Planning and Evaluation on building out an evaluation model more broadly for crisis services. So that work is not quite underway, but will be shortly. We are also, I think I mentioned, finalizing our spend plan for the Safer Communities Act, which is $150 million for the Lifeline in particular, and then actually also working on our proposals for FY24, which seems strange, but that's where we are. Related to the FY22 appropriations, we are required to provide a report to Congress on SAMHSA's approach for a crisis system plan of action. So we are working on that with the expectation that that will be returned to Congress in September. We are having some early conversations about another national convening to support both 988 and that broader crisis continuum. That likely will happen much later in the fall, but we will be engaging many people on this call to have some planning conversations around that. And then lastly, just wanted to mention briefly that we are working closely with the SAMHSA Tribal Technical Advisory Committee, engaged in a number of different approaches, including listening sessions, tribal leader engagement, action planning processes, SME interviews, with ultimately the plan to develop a guidance document that's specifically focused on the needs of tribal nations and organizations that hopefully will come out early in 2023. And then I'll hand it off to Richard.
Thank you, John. Very quickly. So the SAMHSA Community Crisis Partnerships grants, which focus on mobile crisis, but mobile crisis embedded in the context of partnerships with 988 centers, 911, PSAPs, law enforcement, emergency medical services, et cetera. That has now closed. We were very heartened by the strong response we got. They've now gone to review. Awards will be made no later than September 30th of this year, so no later than about 6 weeks or so from now. Also, we will be making awards shortly for our Garrett Lee Smith State and Tribal Youth Suicide Prevention Grants. It's particularly important because of the indications of increases in suicide among young people. Our Campus Suicide Prevention Grant Awards will be coming out in Native Connections. Our Tribal Behavioral Health Grants will also be coming out shortly. And finally, just a thanks to the Crisis Jam for at the start, posting a picture of me with Representative Tina Orwell. We had a wonderful conversation at the VA SAMHSA Innovations Conference, and we'll look forward to more. She's a tremendous champion. Thank you.
Thank you so much, John and Richard. And Richard, that was a great picture of you. So excited to be able to see that. So we have paused until after Labor Day, the legislative and the national and state legislative updates, as well as the crisis calculator. So to bring up our final speaker, can I call Megan Halpert forward to give us the NASHPD update?
Great, Aisha, thank you so much. I really wanted to highlight the NASHPD annual 2022 meeting. It was absolutely amazing. It was the 988 kickoff celebration. That was the theme. It was very inspiring and really centered around NASHPD's 2022 papers, highlighting sustainability practices, child and adolescent practices, CCBHCs, and just a whole host of papers that are going to be posted on our website in mid-September. But I also wanted to highlight that there was a reception that kicked off 988. And as we talk about that 1 mile, we're in that 1 mile, and it really was a milestone. And leaders that had built to 988 were part of this panel, people with lived experience. It was just a facilitated discussion, very heartwarming. And many of the leaders on that panel are on this call now. And wanted to thank SAMHSA also for presenting at our meeting. Miriam Delphin-Rittman was there and presented. John Palmieri was there multiple times. And just thank you, SAMHSA, for your leadership and partnership. It was a great meeting, and we look forward to building on it. Thank you.
Thank you so much, Megan. And before you go, I know that the papers that you mentioned that NASHPD publishes are a huge and important resource for this community. Would you mind just dropping in the chat where folks can find the existing ones and where they'll be able to find the future ones? I know they'll be excited.
Absolutely, I will drop that in the chat. Thank you.
Okay. All right, so I think that we are coming up. Just to let you know that the next presentation will be Jeff Spite is going to be talking really about the need to ensure that it's going to be a focus on youth crisis and ensure that that no wrong door approach to crisis also applies not just to adults who sometimes we might focus on more, but also to youth as well. And I love this this piece here about challenging the notion that you must be 48 inches tall to get on this ride. If you all don't remember how roller coasters work, that's the cutoff right there. And so afterwards, there's a few other presentations coming up throughout the summer and going into September that are going to be really fantastic. You can see here focus on the coordination between EMS and 911. It also look at some work around anti-racism. We also have a focus internationally because I know that many of the folks on this call are not just from the US. So thank you again. It's been a real privilege to be here. This is our 100th jam session. So congratulations on being 100 sessions strong. And we will see you here next week. Take care.